Hey everybody, it's Dr. Charles Modlin here with another Health Equity Brief. As a reminder, these Health Equity Briefs are an opportunity for me, Dr. Charles Modlin, urologist, kidney transplant surgeon, health equity advocate, to relay information to you, the listening audience, that I think is important for you to improve your individual health and that of your family and community. So the subject for today is going to be talking about disparities in the incidence and outcomes of head and neck disorders among African American populations compared to other populations. Head and neck disparities. Physicians who specialize in head and neck disorders are called ENT, ear, nose, and throat physicians, and they're surgical specialists also. Sometimes allergists also are involved in this, as well as thoracic surgeons at times. So head and neck disorders, including nasal polyps and other nasal disorders, can significantly impact an individual's quality of life and health outcomes. Disparities in the incidence, treatment, and outcomes of these disorders exist between African Americans and white Americans. And so in this Health Equity Brief, the aim is to summarize a lot of the disparities between blacks and whites, relevant statistics, potential causes, and treatment options for these conditions. So let's get into talking about the incidence of head and neck disorders. Let's start by speaking of nasal polyps. So the incidence rates of nasal polyps show that there's a greater prevalence among African Americans compared to white Americans. A study found that African Americans have a higher prevalence of nasal polyps, meaning that they're more commonly observed, with estimates suggesting that the prevalence may be as high as 4% in the general population, but higher in specific subgroups. And that's from research data from 2018. Statistics show that according to the American Academy of Otolaryngology, approximately 1 to 4% of the general population develop nasal polyps, but the prevalence is notably higher in patients with asthma and chronic rhinosinusitis conditions that are more common in African Americans. That's data from 2020. So chronic rhinosinusitis incidence rates, it's also more common in African Americans. Studies indicate that African Americans are more likely to be diagnosed with CRS, chronic rhinosinusitis, than white Americans, with estimates of around 11% prevalence compared to 6% in whites. So outcomes, African Americans with chronic rhinosinusitis often report more severe symptoms and quality of life impairment compared to their white counterparts. Another condition is allergic rhinitis. The incidence rates showing that allergic rhinitis is more highly prevalent among African Americans, particularly among children and adolescents. Studies indicate that black children are more likely to have asthma, which is frequently associated with allergic rhinitis. Statistics show that the prevalence of allergic rhinitis in African American children is estimated to be around 30 to 40%, compared to about 20 to 30% in white children. Some of that may be due to environmental exposures, as we've spoken about in previous health equity briefs. Access to care, there's treatment disparities with respect to access to care. We've spoken about this in other health equity briefs. African Americans may face barriers accessing appropriate treatment for head and neck disorders, including nasal polyps. These barriers include socioeconomic factors, lack of insurance, and geographic disparities in healthcare access. Disparities in referral rates for specialists such as otolaryngologists, that's ENT surgeons, can lead to delays in diagnosis and treatment for African Americans compared to white Americans. get into treatment options. Medical management includes corticosteroids, nasal polyps, and for nasal polyps and systemic medications, nasal sprays. Systemic medications are most commonly used to treat nasal polyps and chronic rhinosinusitis. However, African Americans may have less access to these medications due to insurance disparities and socioeconomic factors. Surgical interventions are treatment options. Surgery such as endoscopic sinus surgery. Endoscopic means minimally invasive, is often recommended for severe cases. However, studies indicate that African Americans are less likely to undergo surgical intervention for nasal polyps and chronic rhinosinusitis compared to white Americans. Outcomes for African Americans with head and neck disorders may be poor due to delays in treatment, lower access to healthcare services, and higher rates of associated comorbidities, including asthma. So what are the causes for these disparities? Again, we've spoken about this numerous time again. Socioeconomic factors lead to barriers in accessing health care, lack of health insurance, financial constraints that limit treatment options, cultural factors, certain cultural beliefs, and mistrust of the healthcare system may influence health-seeking behaviors among African Americans, leading to a delay in diagnosis and treatment for head and neck disorders. Comorbidities, higher rates of comorbidities such as asthma and obesity in African American populations can and does complicate the management of nasal disorders and contributes to worse outcomes. Provider bias, implicit biases among healthcare providers can impact the diagnosis and treatment recommendations for African American patients, leading to disparities in care. These are recurring themes across the spectrum of medicine and medical condition, of which we've covered in numerous health equity briefs. So in conclusion, disparities in the incidence and treatment and outcomes of head and neck disorders, including nasal polyps and chronic rhinosinusitis, exist between African Americans and white Americans. Addressing these disparities requires multifaceted approaches that include increasing access to care, enhancing cultural competency among healthcare providers, and improving community education regarding these disorders. By addressing the underlying factors contributing to these disparities, we can work towards better health outcomes for all populations. So please like, subscribe, share this information widely. As I always say, you don't have to be a physician or nurse to be a healthcare provider. Providing your family, colleagues, community with this important information can improve their lives. So until next time, I'm Dr. Charles Modlin. Also visit my website, drmodlinmd.com. You can visit me on X, on Facebook, on LinkedIn, and go to Spotify. You can hear my Music and Medicine podcast, MUZIC, Music and Medicine podcast. So until next time, I'm Dr. Charles Modlin. As I always say in closing, stay safe. Thank you.